So we have an athlete here that has been going to formal physical therapy all year. He's been working on his traps, mainly his right on his throwing arm. He does not fire his trap correctly, and he doesn't really use it when he throws or when he does pretty much anything throughout the day. So they've been working on getting his trap firing correctly and getting his throwing mechanics down to where he's firing that trap muscle correctly. So we're gonna do some myofascial decompression, otherwise known as cupping. The course I went to really emphasizes the myofascial decompression. It's using negative pressure. And we're not really cupping in the sense of ancient cupping. We're not putting fire in glass, and we're not just putting them all over. We're placing them where we want them to get the outcome that we want. So for this athlete, we are gonna test his neck flexion and see if we can get his range of motion greater. And then he'll do some muscle re-education afterwards also. Anytime we do any of the myofascial decompression, we always do some muscle re-education to help prevent that bobblehead effect so that they're not just doing something and their muscles are not learning. All right, so we are gonna test his flexion both to the right and the left, and then we'll do the decompression and we'll see if we get a greater degree from that. So go ahead and turn your right ear down. We're at about 35 degrees on that side. And then your left ear, go ahead. And about 37 on that one. So let's see what we can do. Go ahead and lay down for me. We're gonna start. We are going to do 4 of the cups. So our biggest one, we're gonna put down at the spine of the scapula. And then another one we're going to put at C5, C6 junction. And then another one at T4. And then one up here on the superior side of the spine of the scapula. Actually, let's switch one out. All right, so first things first, we're going to use a little bit of lotion. Just helps if we're gonna glide some of them, it helps let them glide across the skin. And the first one I do, I use actually a curved one. I don't know if you can see that. It's curved, it's concave, so it will actually fit in really well up here. And I take the cup and I kind of feel for some tension, and I usually end up placing the cup where I feel some tension. So right there. And you may wonder how hard to squeeze it. When you first do it, you start off with just 1 or 2 squeezes, and then the athlete will get used to it and you can bump the squeezes up. This is his probably 5th or 6th time doing it. So he knows what to expect. He knows it's gonna be slightly uncomfortable, kind of pinching, and it's not too bad. So I can pump it up pretty good on him. So now I'm gonna go C5, C6. I'm gonna feel there, and I'm gonna just squeeze in. Good? Is that good? Yeah. Okay. Then we're gonna go T4. Whoops. And then the last one, the biggest one, goes on that spine of the scapula. I'm actually gonna put a little bit more lube in here. Oh, goodness gracious. All right. So this one, I'm gonna go here. And you can see as I pump it up, it pulls that skin down. This one's always the best one just because it's the biggest. Get you that good coloring underneath there. He's gonna sit for 3 minutes this way, static, completely not moving. Just kind of let the decompression do its work. Then we're gonna put him through a minute of passive stretches on the ipsilateral side. And then he's gonna do active stretching. And then I'm gonna have him do some PNF scapular decompression. And then we'll take them off and we'll test his range of motion and see if maybe we gain some range of motion. So we're gonna sit here for about 3 minutes and wait. There's some condensation inside. Again, that's from just the skin. It's from the moisture from the lotion we used. Some of them get redder. His up here always gets really dark and red. And he doesn't have any dimpling. Sometimes they'll dimple. They call it a sausage effect. It looks like a sausage patty and it's pretty gross, but it always makes for good, you know, pictures and things like that. So yeah, we're gonna let him just sit and enjoy it. Is that too uncomfortable? Okay. So 3 minutes has gone by, so it's his favorite part. It's the passive stretching. I'm gonna take his arm. He's going to grip my arm, and I'm going to just passively stretch him. I'm also gonna push down on the scapula here so that we're not getting any movement from it. We're just simply stretching. You can't see his face, but it's in pain. A lot of people think, oh yeah, I want the cupping, it's so cool. And it is cool, and it does make you feel better, but it's pretty uncomfortable. And one of the things that they talked about in our course, some like things to look for of kids and patients that want it. You don't want that kid or that patient that's overly eager, relax, let me do it, that's overly eager to get it, because it could become kind of an obsessive thing and they could become actually addicted to it. But I've used it this year in the high school setting, just kind of where I saw fit with him. I talked to his physical therapist about it, done it on a couple other kids, and had some pretty good results with it, but I'm certainly not doing it on everybody. And we tend to shut the door to the training room so that the kids don't see it and aren't like, oh my gosh, I want that, it's so cool. Okay, now he's going to actively do it himself. Go like 10 times. Another thing that I was sure of, I definitely call parents, talk to them in person if I can, to make sure they're okay with me doing this, because it is going to leave marks on their children. And I definitely don't want them coming home with big old hickeys all over them and saying, oh yeah, Sam did this really weird thing. And then the parents have no clue, and then I'm in deep trouble. So you definitely want consent for this. Good. Relax. Oh no, now this. We're gonna scapula. So we're gonna come here. We're gonna press his scapula and have him push back decompressively. Very good. Relax. Go again. Don't use your, remember just your scapula. Okay. Relax. Go. Relax. And one more. Relax. Okay, so as you can see, like this one has gotten pretty big. It's pretty close to touching. There are magnets you can use. I don't agree with them. It's all the whole Western or Eastern Chinese thing with the magnets, and I just don't do it. But they've all gotten some pretty good color to them, and he marks pretty well. So we're gonna start taking them off. This is his definite favorite part because it relieves that tension. This one always feels really good. And I try to, the bigger ones, I try to move around a little bit just to help get that flushed out of there. And you don't want to just fully release it. You want to try and glide them around a little bit. And then the big one. All right, now you always want to flush them out with like a gentle massage after, because you want to try to eliminate a little bit of that bruising, but you also want to get everything back in working order. So I try to do Nice little massage. Doesn't really feel good, does it? Because you're pushing on these big old bruises now. A lot of people will use these for recovery also. It's good for recovery. We try to do this once a week with him. It's been a while since we've done it though. All right, now we're gonna have him stand up. He's gonna go against the door and he's gonna do his muscle re-education, which he already knows. We have him working on using his trap more against the door. And he's been working on it, so he's gotten fairly good at it. Use your trap more. There you go. Good, go to your other one. Don't use your scapula so much. There you go. Yeah, so that's really it. You definitely want to make sure you are re-educating their muscles so that you're not doing this and creating that space in the muscle and the fascia and it not taking effect. You can do that all you want and it feels good to them, but then they're just going to leave and walk out and they're going to be back where they were. So we need to measure him. I forgot. So right ear, no, head up. There you go. Right ear down. And he was at 35 before and he's at 40 now. So we've gained 5 on that affected side. And left ear, sometimes they gain it on that side too. Yeah, he's about 45 on that side. So we achieved what we were trying to go for and hopefully he'll be feeling better tomorrow for our game.